Hello, everybody. Today I'm going to be discussing rehabilitation programs, in particular, drug rehabilitation programs. Hopefully, by the end of the video, you have a better understanding of how they work, how successful they are at getting people over their addictions, and what these programs look like for criminals. So, jumping right in, what is a drug rehabilitation program? Simply put, it's just a program that people can enter to get over their addiction. It can be ranging from as far as an alcohol addiction to a methamphetamine addiction. There is really no program out there that won't take every kind of drug addiction. Meth, opiates, heroin, fentanyl, alcohol, you name it, there is programs out there to help you. They're all over the United States. There's nonprofit programs and state-funded programs for people who are of a low income so they can still get the help they need. So there are ways for people to get the help they need even if they don't have the money. But let's explore how these programs actually operate. Well, most of them actually function on a detox program or a medically assisted detox. The whole point is to get the person off of their drug as quickly as you can without harming them with the side effects of withdrawals, depending on how severe the drug is. Something like methamphetamines and heroin have serious withdrawal effects. So using partial hospitalization care is mainly what they do for people with those kinds of addictions. And this is just intensive care for patients who have to go to the hospital to get medicated to help them wean off of the drug that they are addicted to. It also allows for therapy, doctors, drug experts, and all sorts of people to be constantly checking in on the actual patient to make sure everything's going okay. Another kind of care that is used for these programs is intensive outpatient care. This one, the person with the addiction can actually live at home. They go about their normal life, but they have therapy sessions, expert guidance, and supportive environments daily. This way, they're getting a constant 24/7 feedback on what's going on, how are they feeling, and it really just helps them kick that addiction easier than somebody who wouldn't have such resources, which kind of is what outpatient treatment is. This one is basically really individual. The person is allowed to leave at their house and they go back to work, school, or they do their normal daily routines, and they do have access to therapy and intensive care, but it's not 24/7 like the intensive outpatient care is, or the like the hospitalization one would be. This is a lot more lenient. It's the most lackluster of the treatments that these programs use. This is all about the individual being able to kick the addiction themselves and get the help when they need it instead of having the help come to them. A lot of sources say that this is for like minor substance abuse, but that's not necessarily the case. You can have a serious substance abuse issue like with opiates and still be in outpatient care. It really just depends on the individual and their living circumstances and how often they want the help. Not everyone wants the help of somebody breathing down their neck 24/7, and they may actually cope better if they're on their own and able to deal with it on their own. So it really does depend on the individual, and that's the way they get their treatment given to them. But there is some discussion about whether intensive outpatient care is better than just outpatient care. From what I found, intensive outpatient care does seem to be slightly better just because the person going through the addiction gets constant help all the time, people looking in, checking up on them, which in outpatient care you don't have unless they seek it necessarily. So, people with addictions, having that person there to constantly help you along the way, to help you bridge the gaps of getting over the addiction is really helpful. And not everybody can do it on their own, and that's why there is intensive outpatient care. You still get to live at home, but you still get to have the care as you would of somebody who's in a hospital. So that's why that one's a little bit more effective. But once again, it just depends on the person. It depends on the person, family, and the circumstances of their addiction. So it's all very variable when it comes to the treatment programs and what a person may actually need when it comes to the rehab program. But a little bit on the criminals side of things, a lot of criminals who get caught in possession of drugs, use of drugs, or the distribution of drugs sometimes will actually get court mandated to attend a drug rehabilitation program, which would be just like how any other normal person would join it, except they're mandated by the courts. Another option for criminals is drug courts, which is a little different. Drug courts can utilize rehabilitation programs, but you're mandated by the court and you have to go to a drug court. So they're specifically for people with substance abuse disorders. They offer the programs to the individual, they give them to them, usually at a charge. In the end, they will have to pay it back. Some states, this isn't every state, some states have funded rehabilitation programs, so maybe the person in the drug court won't have to pay it back, but some states don't. And part of the punishment might be paying back what the costs of the rehabilitation program are for going through the drug court. But how effective are drug courts? From what I found, it was very all over the place. A lot of the results say it's within 35 to 40% of reducing recidivism amongst people with drugs and drug-related crimes. So that includes both them using the drug again and committing another crime after the rehab program. But some results say it's actually a lot lower than that, only into the 15 to 20% range. So it's a very mixed bag. Drug courts are very difficult to tell how useful they are. Some states do it better than others, and some states have more funding towards it while others don't. So it's really just dependent on that. But the last thing I wanted to touch on was how successful these rehab programs are for everyone. The most common substance abuse addiction is alcohol, and that is where most of these drug rehab programs see their most success. About 50 to 60% of people kick their addiction of alcohol going through a rehab program. Harder drugs like cocaine, fentanyl, and like heroin tend to see a 25 to 40% success rate, and things like meth is the lowest success rate at 20%. So it really just depends on the drug, the person, and the kind of treatment that they're getting from the program to actually help them through their addiction. But there is success. These programs aren't just all talk, they do work. They've helped a lot of people, and it really just comes down to if that person wants help, and getting them the help, even if they don't want it, is something that is being looked into and forced upon people. But it always comes down to individuals, the kind of therapy that they're getting, or the medical assisted treatment, to actually see a success in a drop of an addiction. But that is all I have for today. I want to thank you guys for watching, and I will catch you all in the next one.